right? So there is a disinclined to mental exertion. वो bore हो जाते, they cannot retain it, and that's why they become sometimes very irritable. They feel कि जितना भी पढ़ो वो कुछ मतलब ही नहीं है. Because of this, they go into absent-minded condition. अब absent-minded में they will not be in touch of reality. There is a startling.
The rubric is mind में starting, startled, spoken to when.
So you will find carbolic acid in it because they are not in reality. They are in their mind. So जब भी कोई उससे बात करने जाएगा, they get startled. And this startle indicates that there is a fear at subconscious mind. So we have talked about weakness of carbolic acid, a weak carbolic acid, prostrated carbolic acid. We have seen irritable carbolic acid. We have seen concentration difficult wala carbolic acid, and it can come in combination. Now we will see one more aspect, which is a very weak and dull personality, very lazy personality of carbolic acid. And this dullness is because overthinking. They are active by mind, but they will not be good in their conversation. They will not be clear about their speech, although they are intelligent. So during case taking, you will find if the lazy carbolic acid comes to you, they will not express their self. And this is not because of concentration वगैरह का problem है, because they are very lazy to express themselves. This laziness can go to the extent of being very imbecile. कि इतना भी हो सकता है कि वो अपना खुद का काम खुद ना करे.
Case of a squamous cell carcinoma of the mouth. He was a 40-year-old male and diagnosed with squamous cell carcinoma. He also mentioned that he was a habitual tobacco chewer. He was an addict. He complained of an ulcer on the left side of the cheek, and the ulcer which was very painful. He also further described that the pain, like he said that the pain came suddenly and it settled suddenly, and it was very unbearable. The pain was extremely unbearable for him. He also complained of halitosis, and he said that he has this feeling of feeling suffocated at the night, and he usually used to wake up because of this feeling. So he had been to an oncosurgeon and was advised surgery for the ulcer, but he opted that he won't go for it, and instead he would continue with the homeopathic treatment. He would start with the homeopathic treatment. Later, he also started losing weight and he stopped working. So the father described about him that during the case history, that he was a very affectionate person and a very family-oriented person. He was also very anxious about the family members. He was always worried as what will happen to them if something happens to him. That is, if something happens to the patient, what will happen to the family? His father also described that when we used to tell him that do not worry, everything is going to be fine, he used to get very irritated. And he did not like if anyone would sympathize him. He also avoided to talk or to meet people.
There is an ulcers, right, which are not getting healed easily. You can think of cancer, right? But in carbolic acid, you will see ulcers which are very irritable and painful. Sometimes you will see painless ulcers also in carbolic acid. Okay? So you will see
Carbolic acid and chamomilla. There are two remedies.
So that how close chamomilla also coming to carbolic acid, right? You want to differentiate phosphoric acid and carbolic acid. So you will see that there is an indifference phosphoric acid, and that is because of two aspects. One is emotional, and is because of loss of vital fluid. Okay, and indifference and aversion to people. Here you will see there is an repulsiveness, means they would be offensive, they would be offending people, but they don't go into indifferent state. So night anxiety, you will see restlessness at night in carbolic acid, anxiety for family. They are not able to concentrate, and memory weakness for recent events. You cannot retain anything. So you will see memory weakness while reading. There was some issue because of which she wanted a divorce from husband. लेकिन उसको अपने husband के लिए concern भी था, चिड़चिड़ापन भी था. So what she came up with the complaint that sir मैं, and she is a business woman. So उन्होंने बोला कि कोई भी डॉक्यूमेंट होता है ना, मैं उसको रीड करने जाती हूँ ना, मुझे वो समझ में नहीं आता है कि मैं क्या रीड कर रही हूँ. This is how the carbolic acid condition can be seen. So you will see memory weakness is more related with concentration. It's not actual memory weakness. Huh? You will see carbolic acid being sad with irritability, and in sadness, they will take a deep breath like hygiene, abscess, physical exertion on.